right now. Vaccinations, historically, the goal of the vaccinations historically is to prevent complications and deaths. A lot of different diseases have been prevented through vaccinations, like polio, measles, chickenpox, meningitis. We don't see these things happening too many times now, and I don't think most people my age even remember knowing anybody who's ever had polio. So we know that vaccines work very well to do that. So quite honestly, we know that no vaccine is 100% effective. We know that from all other vaccines. We know that with flu vaccines and every vaccine that's ever been made. But we do know that they do prevent a lot of complications. We also know that no vaccines have affected fertility or have caused any other adverse effects non-related to the complications related to vaccines. So to translate this to other disease, or to what we're dealing with right now, COVID, COVID vaccines are no different than any other vaccines that we've been dealing with in the past. As we've known and we've said from the very beginning, is that COVID vaccines are not 100% effective. Even with 2 vaccinations, it's only up to about 90% effective. But we do know that right now, with the cases that are emerging in Canada and in the US, that we know that 95% of the cases that are, say 99% of the cases that are dying in hospital from COVID are not vaccinated. So we know that vaccines prevent the deaths that we see there. We've talked about herd immunity, and we've been trying so hard to try and get our 80% here in Kahnawake, but with the Delta variant right now going around the country, they're looking at now as possibly needing 95% effective vaccinations to be able to get good herd immunity. That is closely related to what we know as herd immunity for chickenpox and measles, and they're comparing the spreadability of the Delta variant to chickenpox right now. They're saying that it is spread just as easily as chickenpox and is much more transmissible than the common cold or the flu. We know that the rate of transmission when we originally were dealing with COVID was about 1 person affecting 2 people. And now that we know with the Delta variant, it is that when a person is exposed to them, that they're likely to, like if I had COVID and went around, I could possibly infect at least 8 people. So it's much more transmissible. Knowing all this as well too is that we know that 93% of the cases that they're dealing with in the US now are related to the Delta variant. And we also know that less than 50% of the American population is fully vaccinated. So we also know that right now the CDC at one point had lifted their mask mandate, and so what happens when you don't wear a mask is there's an increased risk of transmission. We know that when you're wearing a mask, if you have COVID, you're less likely to pass it on to somebody, and wearing a mask protects you to a certain point, but it's more about you transmitting to other people. Now, if you go into the US and less than 50% of the people are vaccinated and possibly carrying the COVID vaccine, the COVID virus, if you're walking around, there's a good chance that you might be around someone who's possibly carrying the virus. So it's something we need to think about when we decide to leave, when we decide to travel or go anywhere, what risks we're willing to take. We have to remember that it's not just about the risks that we're taking for ourselves, but for our community as well. So what we know too about the cases that we do have here is that a good number of the cases have been confirmed as Delta variant. We are still waiting for some results of some of the testing for variants. We do know that they're more likely to test positive for the variant as well too, because they're all interrelated mostly. The other thing that we know about the Delta variant too is that it is more likely that if you have COVID from a Delta variant, you're more likely to have headache, fatigue, and loss of taste and smell than to have some of the more respiratory symptoms initially, especially. So if you have headache and fatigue, it's probably a good idea to go get tested. Mild symptoms are important to note and to get tested. It's better to get tested and to be sure that you're not spreading it around, because, like I said, this variant is much more transmissible, and we want to make sure we're not passing it on to other people. Look in that light, we need to look at how we're gathering, who you're with, and what chances you're taking with your family. I think that's all I wanted to cover today. So I'm going to pass on the torch here to Lloyd Phillips, the Director of Public Safety. Yeah.
Thank you very much, Dawn. A lot of very pertinent information that she provided, and some factual and scientific information regarding vaccines in general, as well as how that relates to the current situation that we find ourselves in during this pandemic. And I know sometimes there's a lot of information to digest, but this is available online, that you could rewatch it or re-listen to it over to get that information. We haven't had a show in several weeks, and some of the last words that I left off with was putting the torch, so to speak, back in the hands of the community, and using our collective knowledge to keep our community safe, and that has been going fairly well up until recently. With the new emergence of the Delta variant, and has been confirmed in our community, it is somewhat of a game changer. All the same rules of mask and distance and hygiene and getting vaccinated are still very relevant and required. But we also have to know that the possible spread of the virus is increased with the Delta variant, and we're seeing that around the world, and we're seeing that within our community. With more infections, obviously that will increase the possibility of people getting severely sick, and in turn increases the possibility of somebody in our community dying from COVID-19. And that's certainly the last thing that anybody wants to see. And it's only going to be through the cooperation of the entire community that will be able to break the current trend that we're on, and get us back onto a track where we could continue along the recovery modes of the pandemic. Right now, I think it's important to note that the community should be aware that there is more Delta variant present within our community per capita than anywhere else in the province of Quebec. And we need to break that trend. We need to be able to ensure the safety and security of our community is first and foremost. And as public health and public safety, we can only do so much. We need your cooperation. And by far, throughout the entire pandemic, the vast majority of the community has been supportive and has been working hand in hand with the former task force, now with public health and public safety. But unfortunately, there have been cases where people are not cooperating with public health measures and requirements to keep our community safe. So those people who feel that this is not an urgent situation, I ask you to think twice. And those people who are involved, people and family members, I urge you to speak to your family members, your loved ones, and convince them otherwise, because it's an individual decision. But as Kahnawà and as Mohawk people, the collective always comes first, and your individual choices, could definitely impact the collective of all of us, and the repercussions and the ramifications from that, are immense. We witness here on a day-to-day basis what's happening behind the scenes. There's a tremendous amount of work done by public health and public safety and many others, and the first responders and peacekeepers and such who are directly impacted by what's happening. So it's important that the community understand that we are in somewhat of a fragile state. And as Don mentioned, yes, you can still get COVID-19 if you are vaccinated or fully vaccinated. And this is true for any vaccine. I want to make sure people understand that as clear as Don had mentioned it, but I also want to reinforce that fact as well, because no vaccine is 100% effective. But what it does do is greatly reduce your chances of catching COVID if you are exposed to it. And even if you do get it, it further reduces your chances of getting seriously ill or dying from COVID-19. So getting vaccinated is still the way to protect yourself, protect our community, and a way for us to continue down the path of recovery and looking to a much brighter few months ahead of us. But there is also concern that given the current situation, and if that trend does not break where we're heading, that there could be a major surge in the Delta variant within our community. So once again, I look back to you as Kahnawà, as community members, and everybody working here. It's all our collective responsibility to do our part to ensure that we break this trend and we don't see a major resurgence in our community. We have had a great track record throughout the entire pandemic, and we want to keep it that way. Like I mentioned, the last thing we want to see is people in the hospital, and certainly do not want to see anybody dying from COVID-19. No, we have to heed the warnings. This outbreak in our community is definitely a warning and evidence that we are still in a pandemic. Despite the fact that in the community things have reopened for the most part, there's still restrictions, but things have opened up, the province and the country for that matter. But this is a stark reminder that COVID is still here, and now the Delta variant is here. And we must remain vigilant. We must understand that as normal as things seem to be coming around slow but sure, we can't let down our guard. And that's echoing some of the words that we had said previously. We can't let down our guard, because it is, again, extremely important that we break the current trend that we are on. No, we don't want to overreact in terms of what needs to be done in our community, but we also have to react. And our first level of response to the current situation in the community is doing exactly what we're doing today. Is we are raising the flag, we are raising the concern in the community, and repeating some of the things we have said in the past to remind people that we are still in a pandemic. We can't let our guard down, and we have to remain vigilant and follow public health measures. That's the way we are going to continue down the path to recovery. So there was some discussion about whether or not we need to raise the alert level back to orange, or and start looking at further restrictions within the community. But as a first level, this is our I guess plea to the community, for lack of a better word, so that we don't have to consider alternate options. That community will take it upon ourselves to do what we got to do, follow public health measures, and hopefully, again, change the trajectory so we don't have to consider major changes. However, we know we did look at some of the current measures in place, and there is going to need some changes that will have to take place because of the highly transmissible nature of the Delta variant. There are going to be a reinforcement of certain measures as well as some minor changes, and I'll cover a couple of those right now, but this will be issued in writing as a directive under the emergency preparedness law coming out tomorrow. And this is a reiteration, but businesses that host people such as restaurants, bars, and social clubs, gaming establishments are required to have a registry of all individuals who come into their establishment. And they need to have their name, full name, and contact information on where they can be contacted when they entered the establishment and when they left. This is crucial for in case there is a case or an outbreak, that the public health team can do proper contact tracing, contact the people who need to be contacted, and minimize the spread of the virus. The changes we had made previously regarding masking outdoors for fully vaccinated people remains as is. So if you are a fully vaccinated person outdoors, you are not required to wear a mask. However, there is evidence now that there was a transmission of virus outdoors amongst non-vaccinated people. So if you are unvaccinated or not yet fully vaccinated and you cannot maintain 6 feet apart outdoors, you are required to wear a mask. Masks are still mandatory in all indoor public places, such as pharmacies and grocery stores and other places that we frequent. All organizations in the community, we're going to have to roll back some of the measures we had put in place, whereby if you are able to maintain your 6 feet distancing in a shared office space or a conference room, for example, you were able to remove your masks. But unfortunately, at this point in time, that measure is going to be rolled back, and masks are going to be mandatory in all common places within all community organizations in order to ensure that we curb any spread of the virus. So that includes anything like a shared office, conference room, hallways, and such. Masks are going to be required, even if the 6 foot distance can be maintained. As Don also mentioned about what's happening in the U.S., and 50% or less of the population has been fully vaccinated. If you are not vaccinated yourself, it is highly recommended that you do not travel to the U.S. We know things are changing very fluidly between U.S. and Canada, but if you are not fully vaccinated, it is highly discouraged for you to travel to the U.S. Because, again, your actions could definitely impact upon greater than yourself. It could impact our entire community. Now, we had many people in the past couple of weeks who have been placed in isolation. We had, unfortunately, a lot of active cases over the past couple of weeks. However, if it wasn't for the vaccination rate in our community, we have had, that would have been very detrimental. We would have had potentially hundreds of people in isolation due to the Delta variant, and many more people would have likely been infected. Vaccines again are still vaccination, I should say, are still the key moving forward. There is going to be another opportunity tomorrow. A press release went out today. First come, first served basis. They can contact the Kahnawà Memorial Hospital Center at 450-638-3930 and extension 2295 to leave a message, and somebody will get back to you to book an appointment. And we are looking to the future to have additional vaccination for our community. We will do our darndest to ensure anybody who wants the vaccine will get it and have opportunity to get the second dose when appropriate. Don't be discouraged by the fact that you heard that there was a couple of people who were vaccinated and did contract the virus. However, those people are on the process of recovering, and if they were not vaccinated, the outcome perhaps could have been much worse. So I want to make sure people understand the fact that that the path forward still includes vaccination and following public health measures. We will be back as needed to bring more information to the community. Like, I want to reemphasize one final point, is this was our first level of response. We don't want to overreact. but we also want to make sure people are aware that we are in a very fragile situation in our community. And we don't want to have to go down the path of restrictions at this point in time. But again, I put that back in the hands of the community. On a final note, obviously, we always been talking about the protecting our elders and our most vulnerable. We said that from the beginning of the pandemic, and that's still true. But now, there's also another game changer where, unfortunately, children under 12 are currently not eligible to receive a vaccination. We're hoping in the coming weeks and months that's going to change, but we also have to take steps to protect our young ones as well. Yes, most young people who have contracted or COVID do well and do not have serious complications, but we can't bank on that, and we can't say, well, children don't get very sick, or children do not end up in the hospital, and children do not die, because that's not the fact across the country and around the world. So we have to be mindful of that as well. So that is key, not only protecting our elders, but also looking at ways to protect our children, and doing that in a meaningful way, doing that in a way that we're not going to be, again, overreacting, but a measured response to where we are. With that said, there is ongoing discussions, and with the schools reopening that's coming in the next few weeks, the schools will be reopening. There will be measures in place. There's ongoing discussions with public health, education, and public safety on how that can be done. We'll have more details coming in the near future. But I know there's many parents out there who are concerned about the Delta variant and about their children not being vaccinated and moving forward. I can rest assured that that will be addressed, and it is being considered on a best way to be safe in the coming school year. So with that, this information will be compiled on a directive that's going to be issued publicly to organizations and to the community on where we're at. With that, I thank you very much for listening, and we'll see you again next Wednesday at 2 o'clock for our next scheduled update. Thank you very much.